This is the story of an extraordinary year where COVID-19 changed the world. A 12 months which started with the spread of an unknown virus which has killed more than 1.5 million people around the world, and ends with the hopes for a return to some sort of normal as the first people are vaccinated against the virus. It was on New Year's Eve 2019 when health authorities in Wuhan province in China reported a cluster of cases of a pneumonia-like virus linked to the seafood market.
Doctors in Wuhan were warning that the mystery virus they were seeing in people connected to the market was similar to SARS. By the time the market was closed down on January the 1st, dozens were sick and the virus was spreading fast.
It wasn't long until scientists started to uncover more about the mystery virus.
Almost as soon as the virus we now know as SARS-CoV-2 that causes COVID-19 emerged, we got hold of its genetic sequence. Based on the genetic sequence, they realised pretty soon they were dealing with the coronavirus, and these viruses had proved their ability to jump out of animal hosts into humans, what's called a zoonotic virus, in the case of MERS, which was a disease that came out of camels, believe it or not, and SARS probably out of some sort of civet cat in China. So it looked very concerning given it was following that pattern that we'd seen established before.
On January 20th, China's government confirmed the virus could be passed from human to human. 3 days later, the Chinese government put the city of Wuhan and its 11 million people into lockdown. It would turn out to be the first of many lockdowns around the world. Throughout January, the virus spread around the world as people travelled, with the first known cases being recorded in Asia, Europe and America. By the end of January the 31st, the first known cases were recorded in the UK. As cases grew, so did the death toll. In early February, the number of people in China who died from COVID overtook the number who died in the SARS epidemic. On February 11th, the new disease was named COVID-19. A couple of days later, the virus had spread to 25 countries. As the spread intensified, cases started rising in Europe. February saw Italy becoming the global epicenter of the virus. The northern region of Lombardy had Europe's first major outbreak of COVID-19. With the rest of Europe seeing what was happening in Italy, there was a growing focus on the UK's plan on how it would tackle the outbreak of the virus. The first COVID-related death in Britain was recorded on March 2nd. The UK had by then already declared that the coronavirus presented a serious and imminent threat to public health. On the 3rd of March, Prime Minister Boris Johnson said everyone should wash their hands for 20 seconds, but said the virus wouldn't stop him shaking hands with people.
I'm shaking hands continuously. I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody, you'll be pleased to know, and I continue to shake hands.
On the 11th, the World Health Organization declared COVID a pandemic. By this point, the virus was now in all of the 26 EU countries, with some, like Italy, imposing lockdowns in their worst hit areas. But the UK held off doing anything similar.
On the 11th of March, a global pandemic was declared, but the government was resisting drastic measures. Football was played in front of crowds at Anfield. The Cheltenham Festival was in full swing. The next day, the 12th, Ireland moved to shut down all its schools, but it would be another 6 days before the UK followed suit.
The week of March 16th was when many countries began to close borders and impose lockdowns. This week, the UK government announced social distancing measures, but no lockdown.
Now is the time for everyone to stop non-essential contact with others and to stop all unnecessary travel.
It is a week later, on the 23rd of March, when Boris Johnson announced the UK would go into lockdown.
From this evening, I must give the British people a very simple instruction. You must stay at home.
The government locked down the economy, suppressing activity to protect public health. Businesses were forced to close and many laid off staff. Around 1 million people have lost their jobs since March, and the only reason mass unemployment has been avoided is because the government offered emergency financial support on an unprecedented scale to households and businesses. That was in the form of tax cuts, cash grants and loans. Now, the centrepiece was the government's job retention scheme. At its peak, 9 million people found themselves furloughed at home with their wages salaries being paid by the taxpayer. That's around 1 in 3 private sector employees, and many of those who work in pubs, bars, restaurants, theatres and cinemas would still find themselves furloughed by the end of the year, with no clarity on whether they'll have a job to return to when this crisis ends.
There was an urgent need to increase the UK's capacity to test people for coronavirus to try and limit its spread.
In parts of Asia, the key to keeping COVID cases under control has been a functioning test and trace system. Here in the UK, that system was effectively abandoned right at the start of March, the assessment being that a surge in cases would overwhelm capacity.
In April, the Health Secretary launched a plan to rapidly ramp it up. And with a little creative accounting, tests didn't have to be done to be counted, managed to hit his target of 100,000 tests by the end of the month.
Now, nearly a third of the world's population were living under coronavirus-related restrictions. But while millions were confined to their homes, businesses and schools shut, there were some places, like Sweden, that didn't impose a lockdown at all. Cases were steadily rising, with global deaths reaching over 50,000. On the 27th of March, Boris Johnson becomes the first world leader to test positive for the virus. And at the end of March, to show appreciation for NHS staff and other frontline workers, people began clapping on Thursday nights. At the start of April, COVID cases passed 1 million worldwide. In April, the UK had its darkest days of the COVID crisis. On the 6th of April, a day after being taken to hospital with COVID symptoms, Boris Johnson is transferred to intensive care, where he would spend 3 nights before recovering and returning to Downing Street. Scientists say the peak in the number of coronavirus deaths in the UK happened on the 8th of April, with difficult scenes in hospitals around the country.
The pressure on hospitals in April was absolutely immense. I think the worst part was probably the severe lack of PPE. The anxiety around that for staff was just so great. Plus the anticipation of what was about to happen. Would they run out of ventilators, for example? And then, of course, the reality struck. Huge numbers of patients coming in extremely ill, many dying. There were no treatments, and of course then not allowing family in to say goodbye to their loved ones. I think that really had an effect on many NHS staff.
A couple of weeks into the UK lockdown, the Queen made a special address to the nation.
We should take comfort that while we may have more still to endure, better days will return. We will be with our friends again. We will be with our families again. We will meet again.
Captain Sir Tom Moore also lifted the country's spirits by completing 100 laps of his garden on April 16th, raising millions for NHS charities. And the race for the vaccine was well underway.
By this stage, there were a large number of potential vaccines in development, but we had no idea at that point whether any of them were going to work. The big trials to see whether they had any effectiveness against coronavirus had not begun. We were starting to look at whether these new types of vaccines might be safe, but it was really early days, and at that point we didn't have a clear picture whether a vaccine was going to be achievable at all.
And without a vaccine, the end of lockdowns around the world didn't look like they'd be ending anytime soon. But not everyone was obeying the restrictions.
Perhaps the most damaging moment for the government's public health message came in April, when the Prime Minister's chief advisor, Dominic Cummings, took a trip from London to Durham during the stay-at-home lockdown, and then, having had coronavirus, took another trip to Barnard Castle, he said, to check his eyesight. The Prime Minister let him keep his job.
April was the deadliest month for COVID in Europe, but meanwhile in the US, things were beginning to escalate. By the 11th, America had surpassed Italy for having the most confirmed coronavirus deaths in the world.
By early March, the coronavirus had arrived on America's west coast, and just a few weeks later, New York City itself was the hotspot. And from there, it would accelerate and spread across all 50 American states, bringing with it huge economic disruption. But this was also a presidential election year, and with it would come Donald Trump's greatest test of leadership.
By the end of April and early May, countries like Italy and Spain began easing some of their restrictions. In the UK, the government's stay-at-home message turned into stay alert, as people were encouraged to go back to their work whilst maintaining social distancing. And in the background, scientists were working hard on a vaccine. Moderna began the final stage of its trial on 30,000 participants. As the number of UK deaths went down, non-essential shops reopened in England. New face covering rules were introduced. Now passengers needed to wear them on all public transport. But easing of rules didn't apply to everyone in the UK. Following a spike in cases in Leicester, stricter regional measures were introduced in the city. In July, the rest of England was given the green light to reopen places like pubs, restaurants and salons. July 4th became known as Super Saturday. Global cases passed 15 million in July. Meanwhile, there were some positive developments on the vaccine front.
I think by this point there was certainly some really good news emerging in that several vaccines were coming into these early stage trials and showing the potential to create quite a good immune response against the COVID-19 virus. But it was far from clear at that point because the large efficacy trials, the ones that actually prove whether it can prevent disease happening, had not begun.
Back at the virus's ground zero, in August there were signs that Wuhan was returning to some sort of normal, with thousands attending this music festival. After a summer of eased restrictions and schemes like Eat Out to Help Out, the UK saw the R number value, a measure of how much the virus is spreading, rise for the first time since March. So, to curb the rise in England, social gatherings of more than 6 people were banned, and the rule of 6 was introduced. By the end of September, COVID deaths around the world had hit over 1 million. In the UK alone, there were 42,000 deaths and 441,000 cases.
September saw the return of tens of thousands of students to universities across towns and cities across the United Kingdom. It also saw a rise in COVID cases, outbreaks in student halls in Manchester, Exeter and Nottingham. By mid-September, the government had reintroduced new restrictions across the country, but it was too late in those student areas. Another lesson to add to the government's list.
By early September, a second wave of the virus was on its way, but this time the government aimed for a more regionally based and tiered system of restrictions. Yet even that met local resistance from politicians like Andy Burnham, who wanted more support for affected employees.
So by mid-October, England changed its lockdown approach to creating a 3-tier COVID system, with areas separated based on infection rates and subject to different lockdown restrictions. Wales entered a 2-week-long firebreak lockdown, with Scotland and Northern Ireland remaining under their own restrictions. Boris Johnson said he didn't want to impose another lockdown, but with predictions of the NHS being overwhelmed if no action was taken, he announced a second lockdown for England to last for 4 weeks. But on Monday, the 9th of November, came the news the whole world was waiting for.
We had the results from not 1, not 2, but 3 large-scale clinical trials of vaccines which were effective against COVID-19. And not just effective, what the regulators asked for was a vaccine that would be about 50% effective. And what was staggering, in the case of all 3 of these trials, they were coming in with much higher levels of effectiveness than that. In the case of the Moderna and Pfizer vaccines, above 90% ability to prevent SARS-CoV-2, COVID-19.
It was now a matter of getting the Pfizer vaccine approved by medicines regulators so people could start getting the jab, with the UK drawing up plans to immunise high-risk groups and healthcare workers in the next few months. And less than a month later, after UK regulators gave the vaccine approval for use, on the 8th of December, 90-year-old Margaret Keenan from Coventry became the first person in the world to get the Pfizer vaccine outside of a clinical trial, the start of a huge vaccination programme which will take several months. Regulators in other countries, including the US and Canada, soon following in approving the vaccine. The first vaccines couldn't come soon enough. December saw the number of confirmed cases pass 67 million in 190 countries and more than 1.5 million deaths. There have been over 60,000 deaths in the UK, the worst of any country in Europe. 2020 ends with a battered UK economy and questions about whether the government could have done more to reduce the number of people who died from COVID. But that wasn't the UK's only bad news. In the first 2 quarters of the year, the UK impact of coronavirus forced the UK into the worst recession on record. Although after restrictions were lifted, the economy soon began growing again, meaning the recession was over, the UK's economy had shrunk.
Coronavirus has triggered the deepest recession we have experienced in 300 years. Tax receipts have slumped, borrowing has exploded. The last time a government borrowed on a scale like this, Britain was at war. Now, the recovery that got underway during the summer was more energetic and vigorous than anyone had dared to hope. But by September, it had slowed as the infection rate increased and restrictions were being reimposed. By October, growth was feeble and the economy was still 8% smaller than its pre-crisis size. That is an awful lot of lost ground that still needs to be made up. Now, the government's official forecaster, the OBR, calculates that if restrictions remain in place until the spring, and if an effective vaccine programme is rolled out by the middle of next year, then the economy will return to its pre-crisis size by the end of 2022. But the OBR still expects another 1 million people to become unemployed in the next few months.
When comparing the world's major economies, the UK was hardest hit by the pandemic, along with shockingly high numbers of COVID-related deaths. But could this have been avoided?
Prepare to lose loved ones, the Prime Minister warned back on March the 12th. But as a journalist who attended the briefing beforehand, it was startling as to how few restrictions were put in place. Just over 10 days later, we were in a full lockdown, and shortly after that, the Prime Minister himself was heading to hospital with COVID-19. It seems that the warnings from China and Italy had not been heeded. Matt Hancock, who got ill himself, pointed the way forward by introducing mass testing. It was ramped up, but in the end, it's only the discovery of a vaccine that has really provided a route out of this pandemic.
After such a tough year when many lives have been changed and so many have lost loved ones, will 2021 be the year where we can start to think of returning to some sort of normality?
I think 2021 we will see the back of this pandemic. Obviously the mass rollout of the vaccination in January will be hugely significant. It's not going to have an impact straight away, but by Easter we could start to see some sort of life going back to normal. We could start to begin to hug our family, see our friends, and of course by the summer, I think once the vaccination is well and truly having a proper impact, we could start to see life back to normal.